I think the implementation of a coordinated approach for addressing antibiotic resistance is a work in progress, and I think health departments over the next year or two are going to gain experience in how to access data, how to process data, and how to work with institutions. Right now, what's really important is for hospital staff and healthcare providers to recognize that there's critical importance in ensuring that their laboratories can detect antibiotic resistance accurately. And there's a lot of science being presented at this conference around the right diagnostic testing and the right way to do susceptibility testing in the clinical laboratory. It's critically important for healthcare providers to recognize the importance of sharing data from their hospital with the public health authorities. So overcoming that barrier of not wanting to share information and keep information just within the walls of the four walls of a hospital, that has to be bygone days. We need to emphasize to healthcare providers, and they need to recognize that sharing of data with the health department is one way that a community can really respond more efficiently to antibiotic resistance. So I think at this meeting there is a lot of scientific advances being presented around the best way these data can be shared and the best way these data can be processed to identify just where patients are being transferred and how antibiotic resistance moves between a community. So as advances are made around the treatment and/or prevention of antibiotic-resistant bacteria, we need to recognize that we're not working in a silo. Although the patient is paramount and patient safety is paramount, and we all want our patients to get better, and we all want to do everything we can to prevent our patients from acquiring antibiotic resistance. We need to recognize that by sharing experience with our colleagues and across facilities and recognizing that it's a problem that we all have to share responsibility in is the only way we're really going to address antibiotic resistance and make all patients safer over the next 10 years. There's a lot of science being presented here around the preventability of antibiotic-resistant infections, including C. difficile infection, including carbapenemase-resistant Enterobacteriaceae, as it relates to the gut microbiome, the gut flora, and the effect antibiotics and antibiotic stewardship can have on preventing antibiotic-resistant infections. And I think the more we begin to recognize how to only use antibiotics when necessary in the right dose, the right time, and the right patient, and minimize disruption to our gut, the quicker we're going to be able to prevent transmission and control the transmission of antibiotic resistance across the spectrum of health.